A very good evening to you, and thank you for joining us on Health and Wellness. My name is Zaitun Ali, and today we're coming to you from the Hotel Troy, right here at Magadi Road in Nairobi. The topic of discussion today is about chiropractic adjustment. And on set, I have Dr. Peteka. Is it Peteka or Peteka?
Peteka.
Peteka Ngobeni. In short form, we can call her Dr. Petty. And she's from South Africa. She is a chiropractor. And we also have Dr. Dion Njogu right here on set, who is a physical therapist. And they're going to talk about this procedure, the adjustment. They also call it a spinal manipulation. And they will talk more about it. Welcome to the show.
Thank you.
And I'll start with you, Dr. Petty. You can explain to us what chiropractic adjustment means.
Okay.
Yes.
Hi to all the listeners.
And the viewers.
And the viewers. So basically, chiropractic is what we call, it's a Greek word, first of all.
Yeah.
It means done by hands, right? So chiropractic is a discipline in which we are giving motion to the joints, right? Okay. Specifically more even the spinal joints, right? If you can look at how the spine is, it has many, many joints that are interlinked in order to give us movement, in order to restore motion. Mm-hmm. So what we do as chiropractors, we do what we call an adjustment. Mm-hmm. An adjustment is helping to restore motion in those joints. Okay. So yeah, that's our discipline. That's what we do on a daily basis.
And we've seen videos on TikTok, online, going about this chiropractic adjustment. And in the definition, it is said that you apply a controlled force. It looks really painful. Is it?
Not necessarily.
Yeah.
It might be surprising and a bit shocking.
Very.
It has a component of a pop sometimes, or a crack, what people like to express as a point of amazement. Mm-hmm. For them, but it's really just restoring motion. The clicking and the popping is just the air that passes through the joints as you move the joints. Okay. So you hear that bit of a crack because you are giving that joint motion, and no one gets broken or anything. Ah. Yeah, so okay. Yeah, that's what an adjustment is. It is exciting, but it's also a healing process. Yeah.
I think the much cracking I've had are from my nails only. Is this the same process and adjustment?
Yeah, if you look at how you you do that process, yeah. You basically put it in a fixated form and you release that fixated form. So if it was a little bit bent, you don't do it with your finger straight, you do it with it a little bit bent, and you put pressure in there and it clicks. Okay. So you are giving it motion. You restrict it and you give it motion, then you have that click or that pop.
Thank you so much for that. Dr. Dion, yes. You can talk about how now physiotherapy is linked in between with chiropractic adjustments.
First of all, physiotherapy treatment, yes, is the treatment for diseases, injuries, inability of weight and deformity, mm-hmm. and correction of a poor position for a long time. She has said, Dr. Peteka has said very well, they deal with motion at the joints. For a joint to have a motion, you have to have a muscle, mm-hmm. a ligament, and a tendon. Because the joint where she is causing nice movement, that is where the nerves come through. So if a nerve has been pressed through that joint, the first person to respond is the muscle. It will either shorten, swell, become loose, or even weak. Okay. So for us to be able to allow you to go to the chiropractor, we must make sure that those muscles are in good condition. And which is a good condition, it can contract easily, it can release easily, and it can function normally. So that's why we join the chiropractic and physiotherapy, because after making the muscles good, the chiropractic will move the joints so that the nerve can supply to these muscles.
Okay.
And this is very common because it is not only people who are sick. You can just even stand, follow with a piki-piki, that's not sickness, and you disturb the functions of your muscles, causing the ligaments and tendons to be in a poor position for them to function.
Okay.
So that's why we combine the two professionals. And
Dr. Dion, you know, your camera is here. And there's a reason we were telling you, you need to sit in a position whereby, like I'm doing, like where my camera is, I'm straight, I'm facing towards it. But for you, you told me, no, I need to adjust my seat a little bit because I'm addressing you.
Yes.
I need to look at you directly.
Yeah.
Why was this the case?
The first thing is that when you are seated upright, the person telling us to sit upright is our nerves. Immediately the nerve tells the head or the body to face one side, so it tells one muscles and group of muscles to shorten, so that I can be able to release the other side. So if I'm in this position for long, by the time we finish talking with you, I will be already feeling uncomfortable to turn back to my position, which means I've interfered with the performance of those muscles. Okay. And the nerve will be annoyed and the muscles will also be tight. Okay. So they won't function properly. That's why we say you sit in a proper way.
Well noted. That is very well noted. Dr. Petty, what are some of the, perhaps, why do we do this chiropractic adjustment? What are the benefits of it?
Okay, I usually say anyone who has a spine needs to see us. So if you have if you have a spine, you definitely do need to come for a checkup. Remember, sometimes we go for our dental checkup, we go and get our eyes checked, we go and do a lot of checkups even if we are not sick. You can do that as well for your back. Especially in the kind of economy that we are living in, we are always seated in our computers trying to work, trying to get that money, but we have to take care of our backs. Yeah. So it's very important to come through and get your back checked, and the benefits are that you have better motion of your spine. So basically, a lot of us don't exercise. We are sedentary, therefore we don't spend a lot of time doing good amount of movement. So like doctor was saying that if we stay in a certain position for a long time, your body kind of resists changing that motion. So if you stay seated all the time, your body kind of resists you opening up. Hence, we promote exercising, doing a lot of yoga, stretches, and all of that, because a person is meant to always be moving. And that's why your spine, it has so many joints, it wants to move. So a lot of us are not moving effectively, and getting an adjustment just makes sure that there's enough motion within a joint. And we check for restrictions to see where the joints are not moving effectively, and we tell you about it, especially for those who are still young and the body's compensating a lot, where you are not feeling pain but you do kind of feel stuck, and we try to explain why you are feeling stuck, why certain postures are not good for you, what are the new habits that you need to take on, because a lot of us are experiencing pains that are coming from long-term chronic or what we call repetitive trauma. So those are habits that we need to change from a young age. So we deal with those kind of things, and you benefit with knowledge as well, knowing how your body works, knowing what to do for your body and how to take care of your spine.
Does this mean even children can come for this treatment? And perhaps let me ask, even expectant women, can they come for this adjustment?
Definitely.
Okay.
With women, they experience a lot of changes, especially with a baby growing. There's so much weight that comes, and therefore their spine have to do a lot of compensation in order to keep the body moving, keep the body carrying the child. And remember, with pregnancy, you're carrying the child 24/7.
Yes.
So definitely you need to come, and then we check you, we check your spine, and we help you in ways that you can cope. Remember, pregnancy needs a whole lot of support system, and chiropractic and physiotherapy is definitely one of them.
Okay. And we were talking about posture, Dr. Dion.
Yes.
And I was saying at times I find it hard to just sit upright and look at my camera the whole time for the 1 hour without even slouching. But she mentioned how you can do this even better. Maybe you can explain to us how posture is also, you benefit in terms of your posture when you go through chiropractic treatment and the physiotherapy.
Posture is usually very important on a human being.
Yes.
The animals know how to correct it from the beginning. Even we as human beings, when we are starting school, you will find that the teacher or the lecturers tell you to sit upright. So it is taught from the beginning. When you slouch in the class, the teacher will tell you sit upright. When you grow up and you go to do like a model, they show you how to stand.
Then, hey, they've mastered the art, yeah?
It is even for everybody to be able to master the art. The only thing is that to correct the proper posture, you must be always feeling taller than your height. Always taller, either seated or standing.
Okay.
The secret is to feel taller than your height.
Okay.
When you do that, your muscles of the stomach or abdominal muscles, they tighten up to hold your spine. So if you don't want to see chiropractors frequently, the best thing is to master that position. Always taller than your height. Either you are on the computer, either you are doing the camera, you must feel always taller than your height. I will give you a very good example. We get a lot of pilots of the planes who come always with their back so hammed. Why? Because they say their screen is down here. But we tell them there's a way you can put your seat down and feel taller than your height, so that you maintain the spine in the natural way they have been taken. So posture, you see, like some of you put one leg on top of the other one.
In fact, today I've not. I always do it.
Congratulations.
Oh, it's a good thing?
Yes. Avoid putting that leg on top of the other.
Oh, really?
Yes. So always feel your legs are in the same level.
I thought that was okay.
That is wrong. Then the other thing is always avoid putting your feet together.
Okay.
When you put your feet together, you are forcing your pelvis to protrude somewhere else.
But Daktari, when I'm with my short skirt.
Well, you knew why you are wearing that skirt. So sit the proper way and tell yourself it is normal geography of your body. Don't worry what people think. Because why did you wear the short dress? You wanted to be smart. So remain that way and you be smart. Put your feet just apart, one foot apart, sit upright. Nobody even notice that your skirt is short. It's only you because you are aware. Yeah?
Self-conscious, yeah?
Self-conscious. And always whenever you sit, feel your back always supporting the chair. If it is always supported by the chair, you will be always, and feeling taller than your height, you will always correct your posture because the tummy muscles will support your spine. If you look at the front, there is no muscles. So it is a hollow. We call it the cylinder.
True.
So the cylinder is the one supposed to tell you what position you should sit on. Immediately you are finding you are slouching, they are not working. So who is working? Your spine. You hurt it. So always use the cylinder in front of you by tucking it in, and the way to make it tuck in is only to feel taller than your height, and you get a proper posture.
That is nice. And Dr. Petty, maybe you can just tell us what to expect after chiropractic adjustment is done to your body. How does it heal? How does the body feel? You said, is there physical pain that one can go through? As you also mentioned, what you're going to do for us after the break.
Okay.
Yes.
So basically, sometimes you might feel a relief. Actually, that's what we're hoping for,
yes.
A relief. When
relief. Let me correct. We always come to you help to seek instant. Is it instant relief?
Not always, not always.
Okay.
Simply because, remember we talked a little bit about habits,
Okay.
that your body maintains certain habits that might be wrong, and trying to get rid of those habits, it's a process.
Mm-hmm.
Yes, you will have an adjustment and feel that relief and feel that release maybe from the physio when you go for your physiotherapy session. But then if you continue with habits that are going to impede on your spine, then you're going to have to keep on coming.
Yeah, true.
So basically, it is an instant feeling of relief,
yeah.
Because there's just going to be blood now flowing nicely. As you can imagine, like a hose pipe.
Mm-hmm.
If you've opened the tab and you step on the hose pipe,
Yeah.
The hose pipe bulges up, but immediately you let go, there's a release. So water comes through. So the same with nerves. If you have maybe an imagination of the nervous system, it comes from the brain and then into the spinal cord, and then there's branches which are the nerves, right? They are coming from the spine. So if there's a disturbance, it holds the impulses in, and you feel that people feel pins and needles, they feel neck pain, they get some pins and needles going down their arm, or they feel back pain, they get some pins and needles going down their leg.
Yeah.
It's because that that hose pipe has been, compromised. So when we adjust, we allow it to open up, and then that's the relief that they feel.
Okay.
And sometimes when you feel some pain and discomfort, it's because those joints, when they are not moving properly, they build up. They build up some inflammation, and they cause it to be a little bit painful when you give it a bit of a release.
Ah, okay. And what can maybe soothe that after the adjustment?
Most of the time it will go away on its own.
Okay.
And sometimes you give yourself some time to rest.
Okay.
Rest is very good for the muscles and for the joints. A lot of people don't realize how fatigued they've become.
Yeah.
They're always working. So sometimes it's very good to have some rest. And a lot of people tend to sleep much better after an adjustment. So they report to get enough rest. And if your body is holding a lot of tension in it, you barely get rest.
Okay, so after the break, what will you be showing to us? We'll have a showcase right here together with Daktari.
Yeah,
you get to see it practically, right?
Yeah, then you get to see what is it that we do in our offices, or at least a fraction of it.
Yeah.
And and judge for yourself.
Okay. So dear viewers, you have to stay tuned, and as we're coming from the break, we'll get to see this practically. And in case you have any questions for our doctors right here, feel free to reach out to them and to us at 22151. And remember the socials at KTN Home on Twitter, on Instagram, and on Facebook at KTN Home and at Zaitun Ali. So stay tuned. Welcome back. If you're just joining us, remember this is Health and Wellness, and we're coming to you from the Hotel Troy right here in Magadi Road, Nairobi. My name is Zaitun Ali, and before the break, we were talking about chiropractic adjustment. I'm telling you, throughout the break, I've been trying to stand taller than myself, yeah? But right here on set, I still have Dr. Dion and Dr. Petty from Chiropractic and Physiotherapy Health Center Limited. And I know you're wondering who else has joined us, and this is Shireen, our very able makeup artist. She's looking good as well, makes me look good, and she's right here because she's our muse. We are going to do some adjustments and spinal manipulation on her, and she'll tell us how it feels. Daktari, what are we starting with?
What we are going to start with is the way she is standing, and if there is anything which is not right, and then we shall tell her to bend over. We check on her spine, how it is, if there's anything not correct.
Okay.
Then after that, we tell her to lie here, and then we will examine her when she's lying here. After that, Dr. Petty will come and do the adjustment.
Good. Let's get right to it.
Okay. Stand here. The way you are, try to go down to up to the toes without bending your knees. Do you feel anything? The first thing we shall notice is that her pelvis, where our spinal column sits, is not balanced. How would I tell this? Is that the line of her trouser has been shifted to the left side. So automatically her left side is weaker according to the way she's bending than the right. So that is one thing we have to check. And because of that, you find the muscle of our spine is completely bigger than the one on the right. Why? Because this one is trying to tell the spine to sit properly. So physiotherapists will have to work on this joint and this muscle, which is looking quite tight, to be able to balance it so that she can be able to walk properly. If you look at her shoulder blade, you can stand in Petty. One side is so tight, yeah, compared to her right side. So we have to work this way for physical medicine to release this one so that she can be able to balance herself. In this situation, you will find that her right shoulder is down and the left shoulder is higher. I'm sure you can see this, everybody. So definitely when she is walking, she is leaning towards her right because it is the one which is feeling. So she will look as if she is walking longly towards her right side. So we as chiropractic and physiotherapists, we shall try to manage this shoulder blade, which sometimes you call rotator cuff, to be able to go back to be her in a position which is neutral. In that position, her shoulder blades also will shift from right to left. This one we can see when she lies here on the table. Lie on your table, face down here. And put your hands there. So this is not a mistake that the trouser is shifting to this side. It's because the right is correct, but the left isn't. Such that when you put your hand here, you'll find that this is soft and this is very, very hard, which means she is putting a lot of pressure on her left side of the body. If you feel of what you people call sacrum, hers has shifted from the right to the left. So this is where the chiropractor comes in to shift this bone. Can you feel it?
Can you feel it, Shireen?
How do you feel here? It is very hard, which tells you the bone is completely shifted to this side. And because of that, it has pulled this side of her body, such that if I tell her to put her hand there, to get hold of, you will find you can see the shoulder blade on the right, but on the left there isn't. It has disappeared inside the muscles. So it's the work of us to work on these muscles until it is what? It's completely loose for it to be able to release the shoulder blade.
Okay.
So for physical therapy, you hold her from here and stretch it back this way. And try to stretch the muscles against her or the shoulder blade. And we do the same, this thing on this side. Yeah? And you can be able to put the pressure on her spine. It's not painful.
It's not painful, really?
No.
It's not?
No. It is not painful. And always, whenever you are doing this, you must make sure in a step way. That is, you don't do it also this way. It will hurt your back. You should be always in a step that way. So we have found that she has an issue on her left side, and it is affecting also her neck. The other thing is because we have seen this is completely out of the way. So what we do, we tell her to bend her knee, and this is what is called physiotherapy manipulation. What? Haven't you done? Yeah. So you go to this joint and try to mobilize it to put it back as much as possible. After doing that, you can hold the leg and stretch it out. That way, it helps the bone to go back to the muscle to release. Where it is, this is really protruding compared to this. Yeah? Then you can tell her to bend the knee, put it this side.
Ouch.
And then you try to release the spine from this muscle.
How long should one come to do this type of therapy?
You can come at least 3 to 6 sessions depending on the severity.
Per?
Twice a week or once a week, depends on the severity. But at least between 4 to 6 sessions will make you back. After we have worked all this, now we tell the chiropractor the muscles are well organized and the patient is ready for adjustment. And I hand over
for your
to
magic hands. Yeah?
Yes.
And someone even asked about if it's okay, you can proceed, if it's done in a wrong manner or badly.
If it is done in a wrong manner, the patient will not even be able to leave the clinic. They leave there feeling they can't walk. They are in more pain than they came.
Okay.
So you have to bring them back and do what you have done wrongly.
Okay.
Yes.
Okay, Dr. Petty?
Okay. Like we said previously, that everyone that has a spine can come through to us, but mostly people that come to us have neck pain, back pain, SI pain, or let me say around the bum pain. They have leg pain sometimes. Yes. And then depending on the case that they are bringing, we might even ask to see their x-rays in order to assess what is going on, what are the joints doing, and what pathologies are they. Right? So if we've, after we've talked to the patient and heard what symptoms that they've been having, yes, what kind of problems that they're experiencing, then we can now assess them given their issue. Okay. Right? So we're going to basically look, observe the patient, observe for any misalignment, observe for any abnormality, given that we've assessed everything, including the x-rays as well. And then we check for leg length, especially, well, in this case, the patient has had the SI, the left SI going out, meaning that it's either misaligned or it's restricted. Okay. So we check that. We check that because sometimes it will show in their leg length, simply because a lot of the pressure that they are exerting comes from there going down and from their feet going up. So we check and we see the vision of whether it's aligning or not. And then we also feel.
So for hers, is it aligning?
Currently, this leg is a little bit shorter than this one. So this one is a little bit shorter, indicating that there is more of a fixation that is going on this SI joint. And as you feel, you will feel like there's less give than the other joint. So we do this to compare, and also we go up the spine, because remember, the pressure that is there is going to continue up. So we check the whole body. Even if you are coming with one complaint, we need to still check your whole spine, because one area affects the other. Right? So basically, we check, as well as in the normal office, we will have also observed her coming as she walks. What are the compensatory things that she's doing in order to keep a straight posture? So we would have already known what are some of the problematic areas. So as we go, I'm trying to just feel for where the spine is having a bit of discomfort. Also, the give is not so much. There's less mobilization in those, or mobility in those joints. And we want to try and see if
Can you make the diagnosis without seeing her walk?
Yes, definitely, but it gives us, remember when we say a diagnosis, we first come with differential diagnosis, whereby we are giving ourselves maybe 3 possible diagnoses. And then given after we've taken our own objective information, then we can give a final diagnosis. So when a patient is walking through, we just kind of giving differential diagnosis. And when we've done the whole examination and we've talked to the patient as well, that's when we can give a final diagnosis.
So that's the spine.
Yes, that's me feeling the spine and also feeling the ribs. So with a bed, obviously this bed is more or less pliable to what we do, but we have a more stronger bed where we can be able to do adjustment. But for the sake of what we are doing here, demonstration, I'm going to try not to lean too much into the bed. So after I've felt where we are having restrictions in the spine, then I explain to the patient what I will be doing in terms of an adjustment, so that they don't jump out of the bed and run. Because we don't want that. So basically,
in short, you need to prepare someone psychologically. Because
you need to prepare them psychologically, so that they are able to take in the adjustment.
So for her, what kind of adjustment does she need?
First, I'm going to ask her to turn face up as well, so that I check her neck as well.
You're just receiving here free consultation. Sharon is feeling really good.
So as I was doing to the rest of the spine, I continue up to assess the motion. And also we talk to the patient if they are feeling discomfort or pain.
Are you feeling any pain?
On this side, it's uncomfortable.
Okay. So as I go up your spine, tell me if you feel any joint discomfort, right? So
I'm okay. I'm good.
No discomfort in this area? A little bit? Okay, I'm gonna just press again. Now you're seeing that you can feel there. So basically, when there's no motion, the patient will feel some slight discomfort, even though it's not like really strong pain, depending on how bad the situation is. The patient might report a lot of pain, and sometimes might report just slight discomfort or tightness.
Okay.
Yeah. In this case, as much as she's saying that a lot of discomfort she's getting on this side, there's a lot of restrictions that are happening this side. Okay. So meaning that this side has been compensating a lot.
The left side or the right side?
The left side has been compensating a lot, and this side is the one that's restricted.
Okay.
Right? So basically what I'm going to do when I adjust, what's your name again? Shireen. So what we do when we adjust is give a little bit of motion to the joints that are fixated or that are not moving well. So it might feel like a click or a pop, like that, okay? And then sometimes not, okay? But the main aim is to keep the joint moving, okay? So if you feel a click, it doesn't mean you're broken. It just means there's motion in there. And even if you don't, it doesn't mean that the work isn't done. It means that we are just doing joint motion in there. We're just putting some joint movement in there. Sometimes there is a click, sometimes there isn't. Okay.
Dr. Petty, when you tell me that, I would have walked out very fast. It's sounding like I need to experience pain right now, you know? It's supposed to be comforting, but it's like, what?
Let's see whether she will feel pain.
Okay.
Don't get scared.
As you're winding up, you can just do one.
Yeah, so for presentation's sake, I'm just gonna do one on her neck.
Yes.
Okay, so I need you to relax. I know, even though you're feeling like it's strange, just relax, don't worry. Think of a nice place, happy place.
Think of me.
There we go.
Done.
Yeah, you did hear some clicks, but it was not uncomfortable. It was just surprising, right? Yeah.
How did you feel?
I'm feeling relieved.
Oh.
On that side?
Yeah, I need more.
One is never enough.
Remember, when you do an adjustment, you are allowing blood to flow there. You are allowing the nervous system to also be stimulated. So she does feel a bit of a rush, but it's a good rush that's saying there's restoration.
Okay.
Yeah.
Thank you so much for that. Thank you. This has been very informative and one of a kind. Shireen, thank you for being our model. Our model. Thank you so much. And thank you so much, Dr. Petty. Thank you so much, Dr. Leon. That was very informative. And clearly, she felt it beneficial and she'll be coming. Definitely. So you can save an appointment for her. And any other of the viewer who wants to go, the clinic, where can they find?
We are already in Nairobi. The first clinic we started with is at Karen Ade, just going to School of Law. The other one is on Waiyaki Way, just off the expressway. Just when you look down the expressway, you will see our clinic, a place called Haven Court. And the third one is on Ridgeways, Kiabu Road, just off Motor Hub. It is just there. You can find us there, all of us.
Dr. Petty, where are you located?
Same place.
Okay. Which perhaps they've seen you and they'd like you. Which branch?
All of them.
You go to all of them.
Yes.
So it is Chiropractic and Physiotherapy Healthcare Limited.
Yes.
Great. Thank you so much for joining us today on the show. I hope it's been informative to you as well. Thank you so much for tuning in from the start until the end. And remember, this has been Health and Wellness. My name is Zaitun Ali. And if you want to catch them, they are at www.chirophysic.co.ke. That's the website. Or you can visit any of the clinics. Wamekaribishwa.
Asante.
Yes, sawa.
Yeah,
This
welcome.
show is going up on YouTube almost immediately at KTN Home. And remember, the hashtag is hashtag health and wellness, hashtag KTN welcome home. And the socials at KTN Home, at Zaitun Ali on Instagram and on Twitter. So we'll see you same place, same time next week. And remember, we've been filming right here at the Hotel Troy in Magadi Road, Nairobi. Thank you so much for watching.